Okay, welcome back, everyone. It's my pleasure to introduce the final speaker for this session before we move into the afternoon sessions. And I'm pleased to inform you, if you haven't heard Dr. Gundersen speak before, you are not going to fall to prey to the falling asleep after lunch syndrome. He will keep you interested. Dr. Gundersen is from the University of Illinois at Urbana-Champaign. He's the soybean industry endowed professor in agriculture and strategy in the Department of Agricultural and Consumer Economics, and he's executive director of the National Soybean Research Laboratory. Dr. Gundersen's research is primarily focused on the causes and consequences of food insecurity and on evaluations of food assistance programs. Dr. Gundersen will be speaking up to us today about the family food economy, including the role of WIC in meeting the needs of low-income families. Craig?
Okay, thank you. Okay, so this controls the going back and forth?
Yes.
Okay. Okay, great, thank you. Okay, thank you, Mary Kay. So, I want to thank all of you for coming today to this session. You know, especially thank the committee. I didn't realize we were talking over lunch. You guys got a lot of work to do for this committee, so I appreciate it. So on behalf of the taxpayers, I thank you very much for spending all this time on all this stuff. That's great, and I wanted to thank the committee for inviting me. You know, there's I think I'm the only economist speaking today, so that's great. But there's a number of economists on the committee, which is even better. Just joking. No, so I really am happy to be here. So I was to talk about the family food economy, and they gave me a specific set of questions that I was supposed to answer. Okay, so I'm going to frame my presentation about these questions. So that's not what I wanted to hear about. You know, that's fine. Blame it on the committee because that's what they told me to talk about. So here's the questions: Is how do SNAP and other nutrition assistance programs interact with WIC? That's the first. The second, there's actually 2 and 3, but I thought they best combined into one question. How might individuals get in WIC and one of these other programs shop differently or spend money on food differently? And third, does the availability of SNAP affect redemptions of WIC foods? Now, in all these contexts I'm going to try to give from what may be an economics perspective on some of these issues, but as much as possible, I've tried to done some relatively simple data analysis using current population survey, and I'll talk a bit about all of these as I go through. So I'm confused. Do I have 35 minutes, or do I have 25 minutes plus 10 minutes for questions? Okay, I'll leave plenty of time for questions. Okay. So but when I got this assignment, and they said to talk about this. Oh, this is exciting. This is fun to talk about. I thought of one of the questions that I thought I was going to be asked to do, so I am going to talk about this. As currently constructed, should we anticipate that WIC would have any impact on meeting family needs? In other words, should we think WIC plays a role in this context? WIC does a lot of things, but do we think it should be affecting family needs? And I'm going to talk about this as the final point I was going to make. Okay. I'm more of a SNAP guy than I am a WIC person. Okay, I've done a lot more stuff on SNAP. In fact, I think I've written, I don't know, a couple papers on WIC, including one with Marion. Marion and I wrote one time a paper. What was that? I forgot the topic of it, but it was something on WIC, and it was, I think WIC and food insecurity and WIC, right? And so is that I haven't done much work. So most of my perspective comes from what SNAP can teach us. SNAP is, as you all know, just an amazing program, okay? Whenever I present, I always tell people, if you want to see a successful government program, look at SNAP. SNAP is a successful government program. It has a central goal to alleviate food insecurity. That's what it sets out to do, and it succeeds. Study after study has shown that SNAP is extraordinarily successful at achieving its primary goal of alleviating food insecurity. Not many programs can say they do that. In addition, it seeks to solve food insecurity problems, but it also has all these other advantages that come about. So, for example, it leads to reductions in poverty. There's some evidence leads to reductions in infant mortality. All these amazing things that SNAP does. Okay? Now, there hasn't been, in the earlier presentations today, there hasn't been much discussion. I don't think if anybody has mentioned SNAP at all, but there hasn't been much discussion on SNAP. But I'm going to be talking a lot about SNAP on this. Okay? And part of the reason why I'm talking about SNAP is, first of all, it's an amazing program, but it's also a really high it's a high benefits for families, okay? Is the maximum for a family of 4 is almost $700 a month. And so depending upon, this is substantially higher, of course, than WIC would be, okay? And even for the average benefit level for a family on SNAP is about $250 per month for a family of 4. So SNAP is really a big program, and I think that any discussion of WIC has to include how it compares to SNAP, what SNAP can do, what can WIC do. I mean, everybody's brothers and sisters under the USDA umbrella. SNAP and WIC are both there. So I want to talk a little bit about how SNAP intersects with all this, okay? Now, SNAP has a profound impact on the family food economy. In fact, SNAP is the largest, as we call it, near cash assistance program in the United States, okay? When we think about the social safety net, we generally don't think about WIC, but we do think about SNAP, okay? So in this role, it has a profound effect on the family food economy. Oh, wait, I went too fast. And, as I'm going to make this point throughout the presentation, is WIC can learn a lot from SNAP, okay? SNAP can probably learn a few things from WIC, maybe, but WIC can learn a lot from SNAP. Just joking, of course. I jest. No, of course. I mean, SNAP can learn a lot from WIC. Well, it's not really SNAP learning, people involved in these things. So, yeah, it's people doing it, not the program itself. Okay. So I'm going to show you 2 slides. You want something that's really hard to get is information about WIC. I had all these questions about, well, I'd like to pose a few questions about WIC. Can I get some answers to these? Oh, it's not easy. It really isn't. It's that the government is trying to hide information, and for reasons I'll come to momentarily. So this is the first of 2 figures I want to show. This is a critically important thing. Is look at this. Is at the top you have pretty high participation. This is percent of eligible population receiving WIC benefits, and the participation rate amongst eligible households. And what you see with this is every single year is that the rates of participation amongst women and amongst infants are substantially higher than they are amongst children, okay? This is consistent with the notion that WIC has great coverage of women and infants, really bad coverage for children, okay? Even this figure itself is somewhat misleading, as I'll turn to on the next slide. So not many children participate in WIC. It's even worse on the next slide, though, is what we have here is, this is the only thing I could get on this, was the distribution of age of WIC participants at certification. So high proportion of, what I want you to concentrate on is this number, 2 million, then this number, okay? So you have 4 years of ages, so you'd expect that this number would be about 4 times as high as this. It's not, okay? It's only about, what, twice as high, 2.2 times as high, or roughly. More critical to this is what's happening here. This is a distribution of children between these ages. Look at this, is you have a substantial decline in the number of people who are participating in this program as children get older, okay? You don't have many older children participating in WIC. If WIC is a program that's designed to support families, and you have all these kids dropping off the program, that's something that has to be addressed. In other words, and I'm going to come back to this later to talk about this, but I think that this is really an important point that has to be in any discussion about WIC. Okay, so now the question first question I was posed, now I'm going to want to turn to the questions I was posed. How do SNAP and other child nutrition programs interact with WIC? So what we have here is this is taken from the Current Population Survey. The Current Population Survey, as many of you are aware of, it's what's used to define the food insecurity rates in the United States. It's used by USDA to set SNAP participation rates, a number of other things. So what I've done is I've done these things using data from CPS to compare SNAP and WIC. This is from the December supplement. Now, there's lots of measurement error in reporting of WIC. There's lots of measurement error in reporting of SNAP, okay? Now, what I'm going to be talking about in all this is I'm going to be presenting this as that there's not that there's, in some sense, there's not differentials in measurement error between WIC and SNAP, but more importantly, there's not changes in measurement error over time. Okay, so those are the things that I want to keep clear. Okay, so what we have on this axis then is the age of the child, and this axis is we have the ratio of SNAP participants to WIC participants at the household level. So what percentage of households have a SNAP participant over the percentage of households that have a WIC participant, okay? So consistent with the question, how do SNAP and other child nutrition programs interact with WIC? I could also look at this for school meals, but it becomes a little more difficult because while there's some overlaps in these families, in the main, they're separate categories, okay? So what you find is when we subset this on those who are eligible for WIC, which is less than 185% of the poverty line, many of these households are not eligible for SNAP, and so which makes this even more and somewhat alarming, is what you see then is that for infants, those who are the 0, is that there's more WIC participants. In other words, the ratio of SNAP to WIC is less than 1. So for infants, its participation rates is higher in WIC than in SNAP. This dramatically changes then when turned to 1, all the way up to here, where there's 1.3 times as many SNAP households than there are WIC households when the children change 2, 3, and 4 years of age, okay? So by the time children's, despite the fact that you have this program WIC, which is designed for children, by the time it's 2, is you have this program that's designed for the full age range is already swamping WIC. And I should also note is that this is an underestimate of the true thing because a lot of those households are not eligible for SNAP because the SNAP cutoff threshold is lower than it is for WIC. So this is actually an understatement of the true ratio for this. So what you have is this transition in WIC. Infants, boy, a lot of people in the program, same for pregnant and postpartum women, but over time it switches over to SNAP. That becomes the key point that they're looking at. So how do SNAP and other child nutrition programs interact with WIC? SNAP swamps WIC after just a couple of years, okay? Now, this looks at by age. Now, let's look at it instead by number of individuals within the household. Now, ideally, what we'd like to do is compare benefit levels in WIC with benefit levels in SNAP. For various reasons, that's hard to do in the CPS given measurement error and lots of other issues. But for now, the way to think about this is that per person, let's just assume that the WIC basket is about the same as the SNAP basket. That's actually not true. Per person, the SNAP basket is quite a bit larger, but let's give WIC the benefit of the doubt and say that it's about the same, okay? So what you see here then is that even for infants, there's twice as many people in these households, in a SNAP household versus a WIC household, there's about twice as many SNAP participants, WIC participants, and coming up to here, it's about 3.5 times higher. So SNAP is really just a much more prominent program in the lives of these young children than WIC is. Okay? So the way that WIC interacts with these other programs is basically SNAP becomes the main provider for these low-income households, and WIC, after the first year, really kind of fades away as a program that's benefiting these children. Okay? So that is my answer to the first question, is how does WIC interact with these other programs, and at least presented some information that it's really SNAP that's driving a lot of this. Okay, the second question is how might individuals getting WIC and one of these other programs shop differently or spend money on food differently? Okay. Now, for this I'm just going to concentrate on WIC and SNAP, okay? Because like the National School Lunch Program probably wouldn't have much influence on how people do their food shopping. Same with school breakfast, there's other smaller programs, but in the main, these other programs probably wouldn't have to do this. But you could imagine, in principle, that WIC could influence how people spend their money. People could spend their money differently if they get WIC than if they don't. So, from an economic perspective, I don't know. I just don't see why people would shop differently if they got WIC than if they didn't get WIC. And I take that back. For people getting SNAP and WIC, I can't imagine, because the question poses, and one of these other programs, I can't imagine people would shop any differently if they got WIC or they didn't get WIC. And I say that for several reasons, okay? First of all, is given the SNAP benefits are so much higher than WIC benefits, poor people face a lot of time constraints. As you all know, it's really hard being poor in America, and one problem with being poor in America is you don't have enough time. So when people want to optimize, well, how can I get the most out of my time? What they want to look at is the SNAP benefits, is to say, looking at price, where to shop, looking at quality, looking at selection, looking at accessibility. All these different things would influence where people shop with their SNAP benefits. Okay, so that's the main driver of where people shop. WIC, it really probably wouldn't have much of an influence on this, especially is that there's not many, virtually all, about 95% of all SNAP dollars are spent at supermarkets. and most of these large-scale supermarkets. I mean, these corner stores really aren't that much in terms of SNAP dollars, okay? So virtually every product that WIC is on the WIC approved list is available at the same supermarkets the SNAP consumers shop at. Okay? So if I'm getting SNAP and I'm getting WIC, then I'm like, well, I'm already at the store. I'll just buy, fruits and vegetables or whatever it is on there. Okay? And I already said this, virtually all SNAP benefits. And also as we know, most all WIC expenditures are on infant formula. Okay? So infant formula is available at all supermarkets. Okay? So WIC does a lot of neat things, but it doesn't influence where people choose to shop. At least I can't find any particular reason from a economic choice perspective why people would be shopping anywhere differently because of WIC. Okay. So the next question is does the availability of SNAP affect redemptions of WIC foods? Now, this question was posed, and actually thinking about it a bit more, I may not be answering the right question, but I hope I am answering the right question, okay? So what it could be is that people could be getting WIC, and they say, look, I'm not going to redeem my WIC benefits because I can just as easily purchase it with SNAP, okay? So therefore, SNAP, in some sense, crowds out WIC. So people getting SNAP then is they're getting WIC, SNAP benefits crowd that out. So the way I looked at this then is to look at it with respect to, I put this in quotes, is to compare inframarginal status across various categories. I put this in quotes because the way I'm doing it is not explicitly the way that we look at inframarginal. But here's what I mean is, if people are spending more on food than they get in SNAP, it means that the existence of having WIC wouldn't be crowding out WIC at all. And if this is similar across different groups, in other words, people who are getting SNAP only, people who are getting SNAP but no WIC, but despite being eligible for WIC, or those getting SNAP and WIC. If those are roughly similar across these different categories, then there's really no evidence that SNAP benefits are crowding out WIC benefits, or what would be more likely is that WIC benefits should be crowding out SNAP benefits, but that's another issue. So what we do then is look at this, is to say, here's the results. So looking at participants who get both SNAP and they get WIC, so they're getting both, is what you find is that 85.2% spend more on food than they receive with SNAP. Okay? Now, this actually I think is too low. Other studies that I've seen that look at this issue find 95+% of households that they spend more on food than they get in SNAP benefits. But this is due to measurement error and other reasons. Okay? Now, is looking at the next one then is that we see is SNAP recipients and eligible non-WIC recipients, they spend more on food than they receive with SNAP. So basically similar consumption patterns out of SNAP, whether they get WIC or they don't get WIC. And this is out of households eligible for WIC. If we further expand this to look at all SNAP recipients, those that are eligible for WIC, most of whom are not eligible for WIC, is about the same amount, 86.4% spend more on food than they receive with SNAP. Okay? So the takeaway from this is, first of all, is that for everybody that's receiving these 84.5, these people are receiving more than they get, they're spending more than they get in SNAP. Clearly WIC could be beneficial to them because they would use those other things. But there's no evidence that, at least based upon this, is that SNAP is crowding out WIC. Like people are not, in other words, to say people aren't redeeming WIC benefits because they get SNAP, I just don't see any evidence that that is occurring based on this. Okay? So it's unlikely that SNAP is influencing reduction of WIC foods. And it could also hold the other way. I mean, it could be the case that WIC would be crowding out SNAP, is that the existence of people getting SNAP benefits may crowd out WIC benefits, but I don't see any evidence of that either. So does the availability of SNAP affect redemptions of WIC food? My answer to this would be no. SNAP does not affect redemptions of WIC foods. Okay. Now, the third question this is the one that I thought may or may not be of some interest. As currently constructed, should we anticipate that WIC would have an impact on meeting family needs? Now, I don't want to underemphasize what an amazing program WIC is. Okay, everybody loves WIC. You go to all these meetings, everybody says, "Why isn't SNAP more like WIC?" I'm like, But you do hear that a lot from some people. Okay, everybody loves WIC. And they're right to love WIC. WIC has a lot of neat stuff. It has a positive impact, like Marion's done some really nice work on several outcomes, especially for birth outcomes and infant health. So the fact that WIC has these positive impacts, we should not diminish the importance of these positive impacts, okay? This clearly benefits households, okay? This clearly benefits households, and I don't mean to diminish that. But I don't think, as currently constructed, we'd expect WIC to have much of an impact on meeting family needs. It's just, and I'll give some of the reasons for this momentarily, but I just don't see WIC being a big part of this. WIC has a lot of good things it does. We have to make, well, I don't, all of you have to make a decision about whether you want WIC to have an impact on family food needs or not. What my argument is that it doesn't as currently constructed, okay? And it's really not that appealing. WIC is not that appealing. I mean, I think we have to take seriously that older children don't participate in WIC. We can figure out why that's the case and everything, and I can offer some suggestions on that, but it's just not that appealing. WIC is mainly, WIC, right? It's mainly for women and infants. It's not much for children, okay? So, because of this, is you have a whole swath of the WIC population that really isn't benefiting from the program, okay? Also, across all age groups, the value of benefits is quite small, especially if you compare it to a program like SNAP, as I showed you earlier, or if you compare it to a program like the Earned Income Tax Credit, which is another huge program that gives people a lot of benefits. So WIC, to have an impact on family food needs, is really just too small. And that's not the fault of WIC or anything, but it's just too small of a program to have much of an impact on meeting family needs. Okay? And so to conclude with this then, this slide, unlike SNAP, WIC is unlikely, so I've already said that too many times. You're like, well, does he have to repeat it again and again? No, that's true. So it won't have much of an impact. This is not a criticism of WIC, okay? There's plenty of other programs that have no impact on family food needs. I don't know, physical education in schools. That has a lot of benefits, but it has zero impact on very little impacts on family food needs. There's tons of programs that fall into this category whereby it doesn't have much of an impact. WIC falls into that category. It's a small, well-targeted program that achieves a certain goal, in particular, helping out with infant and childbirth outcomes. Okay? So, making a couple points, but now what I want to turn to is that if you do want WIC to have a bigger impact, what could be done? Okay? So I want to conclude with that, some discussion about what WIC could do to have a bigger impact. Okay. The first is that make the WIC basket less strict and more appealing. Okay? So here's what's happening. Here's what's happening in the United States with WIC today. Because of infant formula, tons of people choose to participate in WIC. We all have to admit that that's the main reason why it's so. Children tend not to participate in this program. So I love Joe Sharkey's, I loved all the presentations, but Joe really hit on something when he talked about what's happening in the areas of southern Texas, okay? He mentioned that a lot of the families in southern Texas, they don't like brown rice, and they don't like a lot of the other things in the WIC food basket. Is it better that those families don't participate in WIC because they don't like certain aspects of the WIC basket or don't like most of the WIC basket? Or is it better that they be in the program and we could be a little bit more flexible with what they eat? So would you rather have them not at all on WIC or on WIC and having maybe not quite whatever we call the ideal food basket? So if we make the WIC basket less strict and more appealing, maybe we'll get more people on the program. Maybe that huge drop-off in older children will diminish. I mean, I don't know how things stand now, but I was like thinking, at least when I looked at this before, it's like you could buy Cheerios, but you can't buy Honey Nut Cheerios? I don't know, whatever the comparison was. Well, is it really that bad if the kids eat Honey Nut Cheerios? I don't know, maybe it is, I don't know. But the point being is that people are not on the program, so would you rather have more people on the program and less strict, or make it strict? No, you can't be in the program. Whatever, I don't know the answer to that. But these are important questions to answer when we're thinking about the possibilities for WIC. Okay, so now I want to really harp on this. Is you look at the studies that have looked at the impact of WIC, I have not seen any that actually show, maybe there could be, somebody should correct me, any credible studies that have been done that show that the composition of the WIC basket is what's driving these results. In other words, nobody's ever said, is it the WIC basket per se that's driving the results, or is it the people are participating in WIC? Somebody should correct me if I'm wrong if there's been some sort of study where people have done comparisons about this WIC basket where we won't let people choose Honey Nut Cheerios and this other one where we do let them choose Honey Nut Cheerios. I don't know. I've not seen a study on this. So WIC's impact then is about the people who are participating in WIC, not necessarily about the food basket. So if we make it less strict, what would happen? It would definitely increase redemption. If I looked everywhere to find information on WIC redemption rates by age, and I couldn't find that. But maybe somebody would know. But if you made it less strict, people would be consuming more foods, right? That would benefit the family, right? Fine, maybe they're buying a few more, whole milk, heaven forbid. So in other words, would that be a bad thing that they're on it? But at any rate, if we made it less strict, you'd have higher redemption rates, okay? It definitely would increase participation by children. And this third one is, I'm always confused by WIC with respect to breastfeeding. I mean, yeah. So from the standpoint of breastfeeding is, you have a program, you have a program that's set up to discourage people from breastfeeding, to put it bluntly. You're giving people infant formula, which is a very expensive thing. You're giving it to them for free. Why would people turn this down? I mean, in other words, this WIC is a program. I have no skin in this game. I'm not an expert on breastfeeding. I don't care if people breastfeed or if they don't breastfeed. I don't care. I don't care at all. These are people's individual decisions. I'm an economist. Whatever people want to do is fine with me. Point being is, though, is the way WIC is structured is it discourages breastfeeding, and we have to admit that. So one advantage to making the WIC basket more appealing to people is make people say, look, I don't like that WIC basket. I'm going to give infant formula. But maybe if we said, okay, it's more appealing to women who might breastfeed, maybe they'll go to breastfeeding. So this would actually, I maybe overstate it, would likely, I don't know, maybe it wouldn't. But it would have the potential. It wouldn't lead to reductions in breastfeeding, okay? Now, the next point about this is that the other thing is how WIC can have a larger impact. Is figure out ways that we can get people on WIC onto SNAP. Too often, I think WIC is considered a separate program from SNAP. Wouldn't it be great if we got everybody on WIC who's eligible onto SNAP? I mean, that would be exciting. So if WIC is a gateway, bringing people from WIC into SNAP, boom. Just think about how great that would be. So let's figure out more ways that we could do this. And finally, is make WIC more like SNAP. Okay? WIC can learn a lot from SNAP, and let's figure out the great things about SNAP that it's doing and how that can be utilized by WIC more effectively. So I hope this is what I was asked to present on. But I left, I think they told me earlier that I was supposed to leave about 10 minutes for questions. So if people don't have questions, that's fine. But anyway, I did leave 9 minutes and now 11, 10. So yeah, please ask questions. There's plenty of time for questions if people have questions. So the question you're posing then is if people received WIC and let's say they were not eligible for SNAP, or they're not for whatever reason. Okay, right. Well, my hunch is the answer still would be no. And the reason I say that is that people who are using, even if they're using cash rather than the SNAP, let's say that they're not on SNAP for whatever reason, let's suppose their income's at 150% of the poverty line, they're not eligible for SNAP, they're just receiving WIC. They have a limited amount of money to spend on these things, and the same story as I told before. They have a limited amount of money to spend, they're going to spend it on stores where they can get the best price, quality, whatever I say, accessibility, and those other things. I can't imagine that the existence of WIC benefits or non-WIC benefits would have any influence, especially since most stores have everything that's on the WIC basket, so I can't imagine it would influence it. Does that answer? Yeah. Okay.
Helen?
So just the economist asking questions.
Okay, Helen Jensen. I guess the economists are asking questions because that's what we're supposed to do.
That's right.
So there are some differences that you didn't address between WIC and SNAP, in that the WIC benefit is tailored to an individual,
right,
and SNAP is tailored to a household. Now, the benefit level is determined by the composition of household. it doesn't necessarily mean that that's the way it's perceived by the household. But maybe if you could comment a bit on how the effectiveness of a program that is triggered by the needs of individuals versus that aspect of SNAP.
Okay. So, I mean, I think we can draw a parallel, I think, with the National School Lunch Program in this context, okay? The way the National School Lunch Program works is, of course, you all know, you go to school, you get the meals there. But to some extent, that those dollars are fungible insofar as that a dollar, was it $3 that are spent on the school meal now goes to other things. So the whole family benefits by having this money. My hunch is that something similar is happening with WIC insofar as those are products that people are buying anyway. I mean, if there's in the WIC basket a certain amount of, say, peanut butter, they will just use their WIC benefits rather than other either cash or SNAP benefits to purchase it. So I think that it's pretty fungible across these things. So I don't really think it makes any difference what exactly is in that basket in terms of its influence on this. Does that answer?
So, yes,
Okay.
though WIC is for certain kinds of foods or groups of foods.
Right.
So would you translate that, those very interesting numbers that you had of 85%
Right.
are spending more on food than on SNAP?
Right.
Would you do that by category?
Oh, I see.
So how is it
Yeah.
that the individual prescription
Right.
affects the composition of,
So-
or the response of the household to those funds?
Okay, so in other words, if I'm understanding what you're saying then, is that we may have some households that are spending more on, say, fruits and vegetables because they're getting WIC than they otherwise would have, that they would be higher than their total food. That's a possibility. It's a possibility. I mean, same thing with the National School Lunch, Primary School Breakfast, probably spending more implicitly on those things by getting the free ride. No, that's right.
Okay.
That could be happening. I can't break this out in CPS.
I know.
Right, yeah, but that's right. In fact, I don't even know if anywhere, maybe with food apps you can, I don't know. Yeah.
Anyone else? We have another economist.
Put me on the spot.
You're next? Okay.
I'm just going to ask a numbers question.
Right.
You made a couple of times the point that SNAP is so much more than WIC,
Did I? A few times?
a couple times,
yeah.
the benefit. But you said a family of four gets $250,
Right.
which is $62.50 per person?
If you say, yeah.
Okay, yeah, I'm doing it in my head too, so I might.
It is right.
I
Yes,
think
it is
that's right.
$62.50.
The average WIC benefit across all categories is about somewhere between 40 to 45.
Right.
Is that the numbers you're referring to? Because in my mind, I thought SNAP was even a larger on a per
Right.
person basis than
Yeah.
$62.50.
That's the average. I mean, I was speaking very rough. I was trying to give WIC the benefit of the doubt to say, maybe it's about the same as a SNAP benefit on a per capita basis. But it's probably not. It's probably on a per capita basis, especially for very low income families who are getting up to $700 a month in SNAP. It's going to completely swamp the WIC basket. Yeah.
Suzanne?
So I'm not an economist.
That's fine.
And so I may be asking the wrong person the wrong question. But one thing I think the committee is interested in is what I think is referred to as leakage, which is some of the WIC benefit is consumed by other family members. And this is somewhat related to the question you were
Right.
looking at. Is there any way to answer that?
So my hunch is that there's a lot of leakage, and I think that's a good thing. I mean, I don't know how to put it. I mean, if a family's, I don't see why that's a bad thing. If so you have a 3-year-old in the family, and suppose they're on WIC, not many of them are, but suppose it's one of the ones that is on WIC, and that family, and they have to buy a certain amount of broccoli, and the family sits down and say the parents make up some broccoli for the child, they're going to eat some of it too. I don't think that's a bad thing. In fact, I would think it would be counterproductive to not allow for these leakages to other people in the family. So I don't see that as a problem. And in fact, I would imagine that for a lot of these products there's a lot of leakage to non-WIC recipients. And I don't see why that would be I mean, the only way it would be a bad thing is if they were saying, you can't eat as much broccoli because I'm going to eat it, and I don't think that's happening. I don't see much evidence of that. So then you also asked a question about how you could test that empirically. I think that would be very difficult to test empirically because you'd have to know what they got from the WIC basket, what that child consumed, what the other members of the household consumed, how they got that broccoli. Did they use SNAP benefits? Did they use WIC benefits? All these other things that go into play in this. I think it would be very difficult to answer that question. But my usual perspective on this, leakage is great in this context.
Angela?
Maybe that's too strong, except not leakage is great. Leakage is neutral. I don't know. So.
And this may be a little bit of a repeat of what you mentioned before, but I'm really interested in when you say make WIC more like SNAP, are you talking about just the restriction on the foods within the basket, or are there other recommendations that you have? Is it just the choice, or are you thinking about something broader?
So, I mean, if one of the, so it depends upon the goals of the program. I really think the main context I'm putting this into is thinking about, I think it's a problem that we have a program that's so unappealing to its target audience. I think that's a problem. And so I think that we can go at this in different ways. It's either we can keep on saying, we're going to tell kids to eat, tell kids to eat, tell kids to eat. And that's all great. Nutrition education is great. I mean, having more nutrition education is, up to a point, is great. Okay. But at some point, we have to think about, do we want to have a slightly less healthy food? I'm putting in quotes because who can define these things, if that will bring more people onto the program. And my argument is, I think we're kind of failing the program if we're not having more children on this thing. So in that sense, is we should, it doesn't have to become, even though I think it'd be great if it's just exactly like SNAP, but let's be let's be reasonable. Let's slightly expand out the types of products people can consume, and still within that really, really broad range of healthy. Let them eat Honey Nut Cheerios. I don't see what the big deal is, you know, but you know, or maybe it is, I don't know. But the point being is, yes, it should be more like SNAP and giving people a little bit more freedom to do. Coming back to what Joe said, I thought his presentation was great. Let's give people the opportunity to participate in this program, even if it's not exactly consistent with their cultural preferences. Let more people into this program. Figure out neat ways to do that. That doesn't seem like the way things are always going in these discussions. Let's instead figure out ways to bring more people in and make it more like SNAP. There's other ways it could be more like SNAP. Easier to get benefits, cut down on some of these other things, but that's the main thing I was thinking of.
Okay, we need to wrap up to move on to the next session, so time for one more question, if anyone has one.
Okay.
Okay.
Thank you again.
Thank you,
I really
Craig.
do appreciate it.